gonna finish wrapping up your wound here. Nice fresh bandage and fresh gauze. Alright, perfect. Now, as I said, that looks very good. It's already almost stopped bleeding, so that's excellent. I know it seemed like quite a bit of blood, but we have a lot of little capillaries in our head, so it can bleed quite a bit and really not be as severe as it seems. So, no, you do not need stitches for that, which is excellent. I'm going to ask you a couple of questions now. Some of this history was taken in the ambulance, so we'll compare answers and get additional information as needed. So I see you were in a car accident and you had a brief loss of consciousness. Do you know how long you were unconscious for? Okay. And can you tell me what you can remember from immediately prior to the accident? Okay. That's more common than you would think. Do you remember where you were headed when you got in the accident? Okay. Have you been drinking at all today? Okay, that's good. And no drug use? Okay, good. Which medications are you currently taking? Okay. Good. And is that still 10 milligrams? And you're not currently taking any anticoagulants or blood thinners such as warfarin? Okay, good. Do you have any history of cranial surgery or head trauma? No. Good. Okay. I'm going to be reading off a list of symptoms, and I'd like you to score yourself from a 0 to a 6 based on how much you were experiencing that current symptom. A 0 would be not experiencing it, a 6 would be extremely severe. Headache? Okay. Yeah, alright. Any pressure in the head other than around the site of that bandage? Good. Any neck pain? Okay, good. Any nausea? Good. I don't see any vomiting in the ambulance. Have you had any vomiting since the accident? Good. Dizziness? Okay, good. Any blurred vision? Okay. Can you tell me how many fingers I'm holding up? Okay. And now? And now? Okay. Thank you. Any balance problems? Okay. Any sensitivity to light? Sensitivity to noise. Okay. Do you feel at all like you are sort of slowed down, like time is moving slowly? Okay, good. Do you feel like you were in a fog? Okay. Any difficulty concentrating? Okay. Any difficulty remembering things that are said to you? And do you feel any drowsiness? Okay. Alright. I'm going to be checking for signs of skull fracture now. So, just get in here. First, I'm going to be looking for any blood or fluid in the ears, okay? I'm going to come in. Let me take a look at your right ear first. Okay. That looks good. I don't see anything in your right ear. Okay. And then we're looking in your left ear next. Yeah. That looks good as well. I don't see anything in the left ear. So no hemotympanum as far as we can tell, and no fluid in the ears. Now I'm gonna look in your eyes. I do not see any signs of periorbital ecchymosis. That would be darkness around the eye, indicative of any bleeding underneath the skin. Like a black eye, so that looks good. Now I'm going to look for any post-auricular ecchymosis, which is bruising behind the ear. Okay, I'm just going to pull your ear gently. Okay, right ear looks good, and left ear. Also good. Okay. Now I'm just going to look in your nose for any fluids. Okay. Okay. Excellent. All right, so that all looks very good. So no signs of skull fracture. Likely we'll do a CT scan anyway based on some of the symptoms you're experiencing, because you had a loss of consciousness, the headache, and some amnesia. So we'll do a CT scan after all of this anyway, just to make sure that there isn't any bleeding or fracture of the head. Now I'm going to come around and we're going to be checking for a spinal injury. So I'm going to be feeling along your spine. If you feel any pain or tenderness, let me know, okay? Just come around behind you. Okay, so I'm going to feel along your spine now, alright? Be pretty gentle, but if you feel any tenderness, just let me know. At the top here. And moving down. Does anything feel uncomfortable at all? Okay, good. All right. So that's a good sign. No tenderness. Any tingling or prickling in your extremities or anywhere else? Okay, good. So that can be a sign also of spinal injury or nerve damage if you feel tingling or prickling. Good there. Now I'm going to be listening to the blood flow in your carotid. Okay, just come in here. Okay, you can just breathe normally. I'm just gonna check that left side first. Okay, that seems very good. Right side. Okay, that seems good as well. I'm just going to go ahead and listen to your heart while I'm here. Okay, excellent. And I'm going to come around back one more time. Okay, if you could just do a deep inhale for me. And exhale. And other side. Deep inhale. And exhale. And just breathe normally for me, okay? Good. Good. Okay, and we'll come back around to the front. Okay. So, arteries sound good, heart sounds good, and your lungs sound good. So physically, from what we can see externally, everything looks good. Again, we're going to do that CAT scan just to make sure, but I'm not seeing any signs of skull fracture. Now, what we probably will have are some neurological symptoms. When you have a concussion, which is what you have from the car accident, sometimes it doesn't present with physical symptoms. It changes the way the brain works, not necessarily causing injury to the brain. So go ahead and ask you some questions to evaluate your neurological symptoms, okay? Can you tell me what month it is? Okay. And do you know the date today? Okay. Yeah, I know I usually have to check my watch or a calendar too. Do you know what day of the week it is? Okay, good. And what year is it? Okay. And do you know where you are right now? Okay. What hospital? Good. And can you give me an estimate as to what time you think it is? Excellent. Okay. Now I'm going to be testing your memory. I'm going to read you a list of words, and when I'm done, I'd like you to repeat back as many of the words as you can remember. They don't have to be in order, just as many as you can remember, okay? Elbow, apple, carpet, saddle, and bubble. Again, that's elbow, apple, carpet, saddle, and bubble. Can you read those words back to me? Okay, thank you. And can you try one more time? It's okay if you've already said the word once. We're starting fresh, so say as many as you can remember. Okay, excellent. Now I'm going to read you a string of numbers. I'd like you to repeat them back to me backwards. So for instance, if I say 719, you'll say 917, okay? 493. Very good. 3814. Okay. 3279. Okay. 62971. Okay. And 15286. Okay. That's okay. A lot's going on right now, so that can be very challenging. Now we're going to do a brief coordination exam. So that's going to involve you holding your arms as such in front of you, like I am. And you're going to, when I say start, touch your nose as quickly as possible 5 times in a row. So we were going for speed and accuracy, okay? So as quickly as you can do it accurately. Again, we're going to start with the right hand. So your right hand, hands out in front. I'm going to do 1, 2, 3, 4, 5. And you can start now. Okay, good. Now we're going to go ahead and do the left, the same thing. 1, 2, 3, 4, 5 times. On the count of 3. 1, 2, 3. Okay, very good. Now we'll do alternating. 1, 2, 3, 4, 5. Okay, start with your right hand. 1, 2, 3, go. Okay. So coordination was good. Now, do you remember that list of words from before? Can you try to tell me as many as possible? Doesn't matter what order. Okay. Okay. Okay, that's okay. So recall is a little bit impaired. That again can be a sign of concussion, so that's pretty normal. We'll look at the CAT scan and make sure that everything looks okay internally, but you do seem to be having some symptoms of concussion. I'm going to go ahead now and check your pupillary reflexes. So I'm going to come in. You said you're not experiencing sensitivity to light, correct? Okay, good. So I'm going to shine this light in your eyes just to see how your pupils react, okay? Good. Okay. Okay, good. Both pupils are reacting to light simultaneously as they should be. Okay. That looks very good. Okay, now I'm going to be moving my light and I'd like you to follow it just with your eyes. Don't move your head, okay? Okay, follow with your eyes. You're doing a very good job. Okay, follow with your eyes. Okay, very good. I'm going to go ahead and cover one eye, have you follow with the other. If you lose track of it, that's okay. Okay, now covering the other eye, same thing. Okay, you're doing a very good job with that. Okay. Now, if you see behind me through the curtain, there's a gurney. I'm going to cover your eye and just keep looking at that gurney. So go ahead, focus on that gurney for me. Okay, keep looking at the gurney. Don't look away. Good, keep looking. Good, keep looking. Very good. Okay. we're just making sure with that test that both eyes are tracking properly. If I were to cover one eye and suddenly the other eye had to refocus, we would know that both eyes don't seem to be tracking in sync, and that's a sign of an issue. But that looks pretty good. Okay, now I'd like you to go ahead and smile for me, nice and big with teeth, okay? Big with teeth. Okay, now neutral expression. I'm going to put my hands on your face, and I'm going to hold on your face, but I'd like you to smile against resistance, okay? Go ahead. Okay, very, very good. Okay, now if you could just open your mouth and close. Okay, now open and hold your mouth open. I'm going to press up on your chin. Okay, very good. Okay, now if you could close your mouth for me. I'm going to hold up on your chin, open your mouth against resistance. Good, okay. So facial muscles seem to be working properly. And one more test for you. I'm going to come around behind you. I have a tuning fork, and I want you to tell me which ear you hear the tuning fork in, okay? Okay. So here behind you, I'm going to go ahead and strike the tuning fork. Okay, which ear do you hear that in? Good, you're good. Left ear, and which ear do you hear that in? Right ear, very good. Both, very good. Okay. Okay, excellent. So hearing does not seem to be impaired. Okay, so you're doing a great job here. Right now, based on your loss of consciousness, that amnesia, blurred vision, and your headache, I am going to get you in for a CT scan or CAT scan. That's going to look at images of your skull and brain to make sure that you do not, in fact, have any skull fracture or bleeding of the brain. I don't suspect it based on the rest of your testing, but with the symptoms that you're experiencing, we do want to do it just to be sure. Now, you are experiencing concussion symptoms as well. So what happens when your head sustains an impact, that can cause the brain's functioning to change, and that's when you're seeing these concussion symptoms. So these can last anywhere from a week to several months. If it lasts longer than 3 weeks, we call that post-concussion syndrome, and we'll talk a little bit more about that when you come back, and we'll get you some documents. Assuming that your CT scan comes back normal with no signs of bleeding or skull fracture, you'll be able to go home tonight. Otherwise, we'll go from there and see what needs to be done. But I don't anticipate there being any issues from that. So I'm going to go ahead and get you on the schedule for that. We should be able to get you right in within the next half an hour. We'll bring you down to the CT scan, get that done for you, and review the results immediately afterwards. Do you have any questions for me? Yeah, so that's going to be just a non-contrast CT scan. If you've had an MRI in the past with a contrast solution, we don't need to do the contrast solution this time, and it is a bit similar to an MRI. However, it does use some low-dose radiation. Where you have never had a CT scan before, and we don't anticipate you to need them regularly going forward, that radiation should not be any issue for you, just the one time. Okay, so I'm going to go ahead and put in the order for that for you, and I'll be back to check on you in about 5 minutes. We'll check in on you until that CT scan is available, okay? All right.